Alright, in this video I'm going to give you a quick overview of Traknet. So after you double click on the Traknet icon that's on the desktop, you should be able to get this login screen. And on here, this is where you can check the provider, select the provider you're going to be working for that day. So that could be Dr. Dustin, it could be Colin Smith, or Sam Spencer. Whoever you choose on this screen, that's what your scheduler will default to. So you'll see their schedule primarily. And when you enter notes online, it will default to them, or when you send them prescriptions, it will also default to that doctor. So you might want to choose the doctor you're primarily working for that day. So if it's, let's say, Dr. Dustin, I would choose him. And this is where we can choose who's logging in. So this will be me. And then enter your password. Alright, and after you log in, there's the tabs along the outside here. You'll primarily be working with these top two. Ignore this. It's top two. The scheduler. So if I were to click on scheduler and today's schedule, so let's click on today, you can see Dr. Dustin's actually out. If there were patients, you would see multicolored. Let's give you a quick view. So tomorrow his day is very busy. As you can see, there's different colors. Black are PPO. Blue, which are not on the screen, are PCA or HMO. Dark blue are PCA or out-of-network HMO. Green are cash patients. Orange are pre-op visits. And occasionally you'll see purple, which are in-office surgeries. And that's just the general overview of the different colors on the scheduler. So you can select the person. If you were to double click, it would bring you up their schedule, but we don't want to do that. But when you click on them, you can come down here and open their chart by clicking on their name. Alright, that's one way to find them. Also, another way to find them is if you go to Patient Chart. You can go up here to Patient Search is another way. You can search out their names. I'll search out Mr. Test Patient. There they are. And then you can enter their chart that way as well. Alright, once you're in their chart, this is the main screen. Mine defaults to Medical Assistant New. If I were to worry about billing, if I were in the front office, I would have this screen primarily up. It's either that one or the Medical Assistant New. But if you're working in the back, this one is the most helpful. It's going to have their vitals, so that's their blood pressure, height, weight, the usuals. It will have also their social history, any medications that they may be taking, any allergies they may have, so some important information. It'll also give you an overview of their last visit and what they were here for. But this is pretty plain Jane because this is our test patient, so we haven't really filled out his chart. Once you're in their chart area, you can click on Progress Notes, and this is where the doctor saw them, and this is what happened. And here's the visit dates. So this were a real patient. This would be very pertinent. This patient had a Taylor's bunion, and they were seen on October 24th of last year. So if you're on the workspace and you're the medical assistant, this isn't your default view, you can change that. I believe you come up to your name. Just going to keep popping up. Come up to your name, and you go ahead and go to Settings. And right here, Default Dashboard, you can change it to Medical Assistant if that's where you primarily work, or if you work up front, you can put it up there. Alright, well that's a quick overview of finding the scheduler, where you're going to find the patient for the day who's coming in, and also if you need to search a specific patient.